Good afternoon and welcome to the City of Toronto COVID-19 media briefing for Friday, September the 25th, 2020. Joining us today is Mayor John Tory, Toronto Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. I want to start by acknowledging that the province of Ontario has taken action today in 3 areas, all of which I fully support and in respect of which I have been advocating to help stop the spread of COVID-19. Bars and restaurants will have to stop serving alcohol at 11 p.m. and close by midnight. Second, mandatory screening at workplaces with simple COVID-related questions to be asked. And thirdly, strip clubs will be closed. I want to thank Premier Ford and the Provincial Cabinet for taking these actions so that we can have a united and coordinated response to the virus in our city, in our region, and right across the province. And that's because we're all alarmed by today's COVID-19 case numbers and by the case numbers we've been seeing in recent days. This provincial action is needed, and in coming weeks, I hope we will see the impact of these actions on the case numbers. The City is also taking action today. Dr. Davila will detail the targeted action that the City of Toronto is taking to address the resurgence of COVID-19 cases in our own city. This action is based entirely on public health advice and is being done under her powers as the Medical Officer of Health. This is real-time action. Dr. Davila came to our command table with this recommended action this morning, based on the data public health has collected up to this point, and I fully support what she is doing. Throughout this pandemic, we have followed the public health advice. That's how we got through the first wave, and that's how we'll get through this resurgence. As I have said before, we are striving to save lives, to protect the health of our residents, and to keep our economy open. That is the real challenge of the resurgence, continuing to stop the spread of the virus without implementing another city or province-wide lockdown that will further cripple businesses, cost jobs, and hurt families. I am acutely aware of the crisis being faced, for example, by the hospitality sector. I'm trying to help them with some of their insurance problems and obtaining more rent relief through the programs offered by the federal government. So I have huge empathy for these businesses. And the action that Dr. Davila is taking today will close some businesses. They must close so that the vast majority of businesses can stay open. This is the type of tactical responses that we will have to take when we find specific hotspots contributing to the spread of COVID-19. It is surgical. I hope the message of today's initiatives being taken by the City and by the province is clear. We will not hesitate to take action to protect the health of Torontonians and the health of all Ontario residents. We will do it based on evidence. We will do it with care and with balance, but we will act because we are absolutely determined, all of us working together, to stop the spread of COVID-19 in our city and across the province. We expect we will have more to say on some other measures based on evidence as early as next week. We need people, the vast majority of whom have been doing the right thing since day one, to acknowledge again and again, day after day, that it is their actions in their own lives that can help keep them safe, keep their families safe, keep employees safe, and protect our entire community. While these actions being undertaken today are important and may well not be the last word, even these actions are not as important as what you can do, either as a business or as an individual. For individuals, again, good citizenship is all that is required in listening to the very basic, simple advice that has been offered as to what individuals can and should do. Please follow very basic rules and very basic health advice which has been made known over and over again. For businesses, this is a matter of simple, good corporate citizenship. Follow the rules and be part of the solution, not part of the problem. I know this sector is struggling, as I said earlier, and we are trying to help. But business struggles are no excuse for not following the rules or for putting public health at risk. And as Dr. Davila will indicate, we have actual instances in which good corporate citizens have gone beyond what is required of them to protect public health, and that's what we need to see. I say to people on this Friday afternoon as we approach another weekend and go forward into the days ahead, do it for yourself, yes, but do it as well for your parents and for your grandparents and for your kids and for the frail elderly and for your friends and for your neighbors and for the businesses and for the city that we all love. We have done relatively well so far, notwithstanding some real tragedy on any comparative basis. We can be proud of how we've handled this all together. We're all in this together. We really are. But now, even more is expected, and I'm confident that we're all up to it. And on that note, I will pass it over to Dr. de Villa.
Thank you, Mayor Tory, and good afternoon, everyone. There are 3 significant developments to discuss today. I will address the current case count for COVID-19 in the city, an outbreak at Glen Park Public School, and I will discuss decisive action we at Toronto Public Health and the City of Toronto are taking to decrease the spread of COVID-19 in our city. Today, I am reporting 236 new COVID-19 infections. The new count brings our total COVID-19 cases to 18,363. A total of 41 people are hospitalized, and 15,725 have recovered from the virus. An increase day over day of this scale is a warning to the entire city. Wherever you live, wherever daily life takes you, you must take the steps for self-protection that we advise you to take. Watch your distance, keeping at least 6 feet apart whenever you can from anyone you don't live with. Wear a mask, again, as much as you can, and certainly when you are in situations where you can't keep at least 6 feet distance from anyone you don't live with. And wash your hands often. These 3 actions done together will reduce the risk of COVID-19. And if you're not being disciplined about them, I ask you to please start. As well, Toronto Public Health has declared an outbreak at Glen Park Public School. This is the first declared COVID-19 outbreak in a Toronto school. But first, some important context. The word outbreak may sound ominous to you, but this is what it means in the case of COVID-19 in schools. This definition of an outbreak is set by the province so that an outbreak is defined consistently at all schools in the province. And it means at least 2 confirmed cases of COVID-19 within a 14-day period and with a link to a school setting. This definition supports a swift response that will help manage the spread of COVID-19 aggressively. In this instance, 2 students have been confirmed as positive for COVID-19. This meets the standard for the provincial definition of an outbreak. The established protocols to manage the situation and limit risk are being followed. The 2 students infected have been isolated to recover from their illness. 1 teacher and 2 class cohorts, one of 17 students and another of 18 students, have been sent home to self-isolate and will remain at home for 14 days. Parents in the school community have been notified in writing. At the school, all infection prevention and control measures continue to be followed strictly. This includes masking requirements for students and staff and enhanced cleaning measures. Again, all steps have been followed as expected in a situation of this nature. One of the realities of living in a world with COVID-19 is that there will be cases in schools. Today's news is expected. I expect there will be similar announcements in future, and you can be confident the steps developed to manage the situation and reduce the risk of spread will be followed. Now, to the subject of actions we are taking under my authority as your medical officer of health. During the next few hours, orders under the Health Protection and Promotion Act will be served to 4 businesses in the city, ordering their closure until such time as they satisfy the conditions spelled out in the orders. These are specific actions to arrest transmission of COVID-19. These businesses are hospitality-focused, and the reasons for the orders are distinct to each business. Because the orders are presently being served, I can't speak to specific circumstances until service is complete. But I can tell you broadly, there were several concerning factors that led me to take this action. First, we found a concerning link involving these locations. Our investigation found that many people are connected to more than one of the 4 businesses. Our investigation also found evidence that in some instances, people infected with COVID-19 were employed at more than one of the 4 locations. In another instance, one of the businesses served food buffet style, which is clearly prohibited under existing provincial regulations to limit the spread of COVID-19. Second, the operators of these businesses were frequently uncooperative with our investigators to the extent that our investigation efforts were significantly impeded. In some instances, we identified situations where staff were working while ill. We also became aware of concerns that staff were being pressured to work while ill. These factors combined to create a significant risk to efforts to limit the spread of COVID-19, and so I am acting under my authority to close down these businesses. These are not actions I take lightly, but I act first in the interests of public health, based on the data and the facts of the matter. In these circumstances, the action taken is the right action to protect your health. The names of the affected businesses and their locations will be released to media once the process of serving the orders is completed. We look forward to the resolution of these matters and hope that the businesses involved will comply with all the actions required to lift the orders and allow them to return to operation in a safe manner that sustains public health. I also want to stress that our investigations, for the most part, are characterized by cooperation. Some of the businesses we've dealt with have gone above and beyond. For example, closing voluntarily for deep cleaning or to adjust operating procedures. Others have implemented measures to protect staff, customers, and broader public health. For example, some have reorganized staffing requirements to keep employees fixed at one location in response to COVID-19. I commend the businesses that are acting in ways to protect our city's health by balancing the operation of their business with the interests of the people of Toronto. They are an example to our local business community. Tough times demand tough choices, and these businesses are stepping up. With this weekend just ahead of us, I ask that you too step up by watching your distance, wearing your mask, washing your hands, and as always, taking care of each other. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 199th day of continuous Emergency Operations Center operations. Our EOC continues to operate, and our critical and essential services are being provided without interruption. At present, our PPE levels remain stable, and our team continues to work hard to maintain the equipment we need on a go-forward basis. As we reach the 200th day mark of continuous EOC operations tomorrow, I would like to acknowledge and thank every member of our team who gives their all. Toronto Police, Municipal Licensing and Standards, and Toronto Public Health have each established dedicated teams of enforcement officers in response to COVID-19, and specifically in response to the restrictions on gatherings and the evolving restrictions on business operations. This is difficult, yet important work, and I extend my personal thanks to every member of our enforcement teams who are doing their very best to protect our health and safety. Our dedicated teams are actively engaged in enforcing COVID-19 related laws now, and will continue to do so tonight, over the weekend, and moving forward. These teams will enforce the provisions of the Reopening Ontario Act, including new regulations announced today by the province and the forthcoming orders from Toronto Public Health. As we head into the weekend, I remind everyone that the limits on gatherings are no more than 10 people indoors and no more than 25 people outdoors. Complaints with respect to gatherings or other COVID-19 related orders should be submitted to the City via 311. I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. There are a number of staff on the line to answer specific questions should reporters have any. We'll go first to Lucas Meyer from News Talk 1010. Lucas, go ahead.
Thanks a lot. My first question to you, Dr. Davila, and it has to do with this whole issue of where exactly we are. And I know you had kind of touched on this earlier, but I'm just wondering, based on what we're seeing in the City of Toronto right now, and some of the language being used by various medical officers of health on a national level and on a provincial level, in your eyes right now, is the City of Toronto in a second wave?
So, Lucas, you've heard me speak about this before. We were certainly expecting increased activity and a resurgence of activity. And I know that there is, I guess, a leaning towards using the term second wave. Some people like that term. I have generally not used that term because I find that it gives an image of what the future activity will look like, that it will come in a very specific form and present in a very specific way. And I think it's really important that while we do expect to see, and we were expecting to see an increase or a resurgence in COVID-19 activity, that it actually rests in our hands as a community, what form and how much activity we will actually see in our city. It's not entirely in our control, but significantly in our control through self-protection measures that we can each adopt, whether it's watching distance, wearing your mask, washing your hands. These are the mainstays of self-protection. And as we've just seen today from the province and certainly from us here at the city, there are some measures that we can take to help support people take those self-protection actions and to reduce the risk of COVID-19. So yes, a resurgence of activity, and it's now in our hands to take appropriate measures at the individual level and at the government level to reduce that spread as much as possible and own our future.
Thank you, Doctor. And my next question, I think, to the Mayor. Mayor, now that these new rules, these new restrictions are in place, granted on the bar and restaurant side, I mean, the strip clubs are closed, and on the bar restaurant side, it's more so the reduction in the hours and the service. In terms of enforcement, are you concerned with, how much we're going to have to ramp up enforcement at all? If you feel that, people who may now not go to these places where they could before, or may take their events or gatherings, at parks or private parties or other places, how does the enforcement play into what we're going to see now with these new restrictions and rules?
Well, there's no question but that, one of the risks, if I can call it that, of actually enforcing the law and having rules that are tighter in the interests of public health is that you drive this activity to a place where you can't see it and people are still sitting shoulder to shoulder. The issue isn't with people having a drink or having fun. The issue is that they're sitting shoulder to shoulder, no masks, and that is causing the spread of this virus. And so it is my hope, again, law enforcement people make their own decisions about where and when they go and what they do when they get there. But it is my hope that the combination of these new, stricter rules, plus enforcement resources being put into the areas where we know there's more of a problem with the spread, because we have some of that information, it's been made public, and people accepting, people meaning individual people and businesses accepting personal responsibility, the most important part. The combination of all that will arrest these numbers and stop the kind of increase we're seeing.
Okay, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey there. I'm wondering if there's any evidence that the rise in cases is at all related to bars and restaurants.
So I'm sorry, Jennifer, you're asking if the rise in cases is all related to bars and restaurants?
No, is it related at all to bars and restaurants? Do you see any evidence of it being linked to people gathering at bars and restaurants?
Okay, thanks, Jennifer, for the clarification. I think what we're seeing here is the result of interactions between individuals, right? We've heard that, now we're, 9 months into this pandemic, and where at the beginning we didn't understand all that much about COVID-19 as a novel virus. And I'm not saying that we understand absolutely everything yet. It is still relatively new. But we do understand more about its transmission now than we did at the beginning. And what we know is that you need close contact. And it's even more pronounced when that close contact occurs in a crowded space, in an indoor or enclosed space. These are the circumstances that give rise to transmission, because you get contact with the droplets that come from the nose and mouth of an infected person and come into your own eyes, nose, or mouth. So it's close contact that provides for transmission of infection. Sometimes that close contact occurs within the context of a bar. Sometimes that close contact occurs within the context of a restaurant. But in fact, when we look at our case data, it is from close contact, sometimes even within your own household. So living with somebody who actually has a COVID-19 infection is one of the highest risk situations with respect to COVID-19 transmission. So fundamentally, it boils down to close contact. The locations are just a question of where that close contact happens to occur. But that's why it's so important to really focus on those self-protection measures, watching distance, wearing a mask, especially when you can't maintain that distance, and washing your hands, because these are what actually arrest the spread of the disease from one person to the next.
And for Mayor Tory, you asked the Premier in mid-July to do something about the open hours and alcohol serving at bars and restaurants. He's only now taken action today. Is there not reason for the city to take matters into its own hands and perhaps implement further restrictions, whether or not the legal authority is questionable, to try to roll back some of the current allowances in order to protect the residents of Toronto?
Well, when you use the expression whether or not the legal authority permits it, we have to operate here on the basis that you can do what you are authorized or entitled to do under the law. And one of the things that's been very persuasive for me has been the fact that if we did things that turned out to be really questionable by those affected, they have the right to go to a tribunal where they could take the medical officer of health, not a lawyer on her behalf, not other staff members, but her, because these orders are issued by her, and they could have her tied up in hearings for a long time. So that's why we've had to be so careful, among other reasons. You don't want to also have a law that is struck down or found to be ineffective, because then that, I think, undermines all of what we're trying to do to get people to cooperate. I mean, our preference is to get people to cooperate, not just, follow the law because we ordered them to do so. And so we've been careful in dealing with the province, and there are instances in which it was better for them to act, and in fact, maybe the only option really for them to act that was effective. In other cases, we've acted. As you can see, the doctor here has taken some individual actions, which we've never questioned her ability to take. We, meaning the lawyers and everybody else looking at all this, are A challenge was with respect to blanket orders, which there's considerable question as to whether we have the authority to issue them or not, and that was the subject of some debate a few weeks ago. So you put forward what you believe to be right at the time you put it forward. So any letter that I've written to the Premier or anybody else, anything that I've said, I believed at the time that I said it or wrote it, it was the right thing to do. If it ends up happening later, then that's fine, because if it's still the right thing to do, then it's the right thing to do. And in this case, while I very much regret the fact that it will have a slight negative impact on some of these establishments who are struggling, and I acknowledge that, public health has to be something that we place at the top of our priority list, and that's exactly what we're doing, and that's what the Premier has done by now altering the hours of these bars and licensed premises.
Okay, thank you. We go next to David Ryder from the Toronto Star. Dave, go ahead.
Hi there. My first question is regarding schools for Dr. Davila. You mentioned that this is the only one considered an outbreak. I looked at the website before this briefing, and I noticed that there are some that have, in fact, more cases. I think Richview Collegiate in Etobicoke has a total of 3, and I believe it's 3 different students. So just because people listening to this might think that this one school has like the most dire case or the most COVID, I'm hoping you can just parse out a little more clearly as to why this is an outbreak and not some of the other schools that have multiple cases.
So that's an excellent question, and you'll notice it all rests in the definition. So the definition of an outbreak is, at least 2 cases within a 14-day period, with one linked to the school, with one at least linked to the school. And the question is, what is the circumstance in each situation? Sometimes you get cases within a context of a school, but those cases are members of the school community, but in fact the infection was acquired elsewhere and had nothing to do with the school. So I can't speak to every circumstance that might be on the list, but it all rests on the definition and understanding specifically what is the risk situation at the school. The point of declaring an outbreak in any situation, whether it's a school or any other institution, is to actually allow for a swift response and to bring the resources to bear, to bring the infectious disease outbreak under control. So that's really what the point of declaring the outbreak is to make sure that you're marshaling all the resources that are necessary, that the appropriate attention is paid to the circumstances so that we can manage the risk and reduce transmission. But, with respect to what the numbers look like, it may just be a question of what the situation is at the school, and sometimes what's associated with the school community isn't actually linked to the school or in some other way doesn't meet the definition of outbreak.
Thank you. And my follow-up, maybe I can hit for both of you, is on bars and restaurants, and that's Mayor Tory, on one of the morning interviews, you said you didn't have evidence that closing them early would necessarily reduce the number of infections. I'm just wondering for Dr. Davila if you guys have any data that says closing at midnight will. And then just to follow on that, I think this would also be from Dr. Davila, is earlier we had the province sort of suggesting bars and restaurants weren't the problem, it was private gatherings. You seem to be giving a different message, and you seem to be giving that message again today that in some cases they are the problem. So I'm just wondering if that's because Toronto has more of a problem than other parts of the province, or are you guys tabulating it differently, or if you can explain that disconnect?
So let's start with the multiple questions there. First, let's start with the fact that there isn't specific data that can timestamp when infections occur. But what we do know is that as people are out socializing in the evening, and as alcohol consumption, for example, increases, it does lead to a letting down of the guard, and we do find that people's inhibitions are down. And what happens then is that the self-protection behaviors and the self-protection measures aren't as well practiced under those circumstances. And we know that when you don't practice those self-protection measures, that's when infections occur. Further, I would say that with respect to locations and where infections occur, certainly wherever there are closed spaces with lots of people and close contact, those are the circumstances that give rise to infections. Sometimes that happens within the context of a private home. We've certainly seen that throughout the province, and I think there are numerous examples of that, both here in the City of Toronto and elsewhere, with respect to what our investigations reveal. Sometimes those circumstances happen within more formal settings, like bars or restaurants. But fundamentally, it does come down to close contact between people, somebody who has a COVID-19 infection, the droplets that come out of their nose and mouth when they breathe or talk, enter into the eyes, nose, or mouth of another individual. This is how infections result when it comes to a disease like COVID-19.
Could I, Dave, just comment on that? You know, I've sat here all this time, and I listen very carefully to what Dr. Davila says in our briefings that we have, you know, each day, but also what she says when we're here, holding ourselves accountable to you. And I've heard over a period of time that we've been at this for quite a few months now, I've heard parks, I've heard play dates, I've heard beaches, I've heard parties in people's houses, I've heard bars and restaurants, all as places where, depending on the behavior of the individual, or for that matter, the behavior of the owner of businesses or of a house, all, you know, as places where the virus can spread. And so I just think that the kind of action that Dr. Davila undertook today is entirely responsible in that it identified people who, as she indicated, are people who in some cases have not even been cooperative. Why would any business not be cooperative with public health investigators who are going around just trying to make sure that we all stay healthy? And so to me, it's a targeted, tactical action that doesn't sort of say we're taking an entire class, even if we could, of businesses, for example, and address them. It says we're going to take some ones that have been a particular concern, and she's going to exercise her power to deal with those. And so, you know, and I indicated this morning with respect to what the province did, that I had certainly been persuaded over time that if you had a slightly earlier closing time, and it's really not that much earlier, a slightly earlier closing time, you would probably lead to circumstances in which you'd have those inhibitions remain in place more firmly, and people would keep their masks on and would keep their distance from each other to a greater extent than if they were there 2 hours later at 2 o'clock in the morning. And so as a result, that's why I'm quite happy to have recommended that some time ago, but also to see the Premier and his government do it today. It's the right thing to do. It will help. None of these things are a magic solution as far as we've been told.
Okay, thank you. We go next to Ben Spur from the Toronto Star. Ben, go ahead.
Hi, this is a question for the mayor. Were you aware that the city had suspended the Fare Pass transit discount program back in March? And do you feel it's right to pause a program that's supposed to help vulnerable people at a time when so many people in the city are struggling?
You know, in the last, I guess, 9 months now, I've had to deal with so much bad news that has related to very important programs that we weren't able to deliver quite as we would like to have delivered them for a whole variety of reasons, things we've had to cancel, sacrifices we've asked people to make. In this case, it just wasn't possible to process new applications for the Fare Pass during the height of the pandemic. What I will say, in fairness, we were able to renew those who had already received a Fare Pass because that was an easier administrative task to perform. But there are many, many instances which, regrettably, governments and other bodies, businesses have not been able to carry on with the enrollment of new people in new programs. And I'm sorry about that, but we're going to work to get this back online and get new applicants able to fill out their papers and get on the program as soon as possible, because that's what we're trying to do to get government reopened to the maximum extent possible, especially for those who are most vulnerable.
And just as a follow-up, up until yesterday, it doesn't appear that there was any notice posted to the program's website alerting people that it had been suspended. One client I spoke to said she was bounced around between the TTC, Presto, the city, and ODSP for weeks before someone told her it was on pause, and she still hasn't been able to get her pass renewed, despite the city saying that that should be possible. Do you think that the city has done a good job of communicating what's going on with this program to the public and ensuring that no one has been left behind?
I don't know how many hundreds of different programs, and I don't mean to minimize the importance of this program, which allows some of our more lower income residents to ride the TTC, or those who are on disability pensions and so on. It's a very important program. It was one that was initiated while I have been the mayor for the first time ever. And I don't make excuses for the fact that many of these different programs have not been able to be operated in the normal manner during the course of an emergency pandemic. Have we done as good a job as we might communicating all that information? I would say it's virtually impossible for every single program to be communicated in detail to every single client group. I think we've made very clear that we were keeping critical services going, the things that are a matter of life or death, that we were doing our very best to keep everything else going. We have processed these renewals. I apologize for that experience that this person has gone through. Somebody should have done better at sort of saying, well, yes, you can renew this and we'll help you. And I would say if that person wants to be in touch with my office, we will just make sure it gets renewed if they're still having trouble. But I think we've done a pretty good job of keeping services going, communicating with people as to what we're doing to exercise our best efforts, and we will get these programs back up and running again just as soon as we possibly can. That is our commitment.
Okay, thank you for that. And the final question is to Scott Lightfoot from CTV News. Scott, go ahead, please.
Thanks, Brad. Question for the mayor. You touched on it before, but I'm just wondering if you could speak directly, if you have a message for the owners and the staff at restaurants and bars. We've spoken to a bunch of them this afternoon. Many of them are saying, look, we've done everything we've been asked to do. They're already dreading with what's going to happen when the patio season ends. Many of them are openly admitting they can barely keep the doors open. And now they have these service reductions. You said, I believe your term was slight financial impact, but some are saying it's going to be a lot more than that. What would your message be to those people whose livelihoods are on the line here?
Well, first, I'm sorry. There are a lot of livelihoods that are on the line as a matter of life or death in an emergency health pandemic. And I'm sorry that that's the case for all the people affected, including a group that I've spent a lot of time trying to help as mayor. I've advocated on their behalf to the federal government and received a quite positive response with respect to the need, for example, going forward for continued rent assistance. Was advocating with respect to the continuation, which, to give them their due, the federal government extended the wage subsidy program. I've spoken up in recent days and will be in touch with people that may be able to look after some of these insurance problems we see. And these are big items that I think will be helpful. And, of course, the programs the city itself brought forward that you mentioned, like the Cafe TO program that made hundreds of additional patio spaces available, I think were helpful. But we cannot be in a situation where, and you'll notice that the action undertaken today by the city government, the city medical officer of health, is targeted. And these are people who have demonstrated some degree of non-cooperation with the public health authorities. The action undertaken by the province is more significant and obviously applies to everybody. And what you hope is that, like many of the other things that have been done by governments, regrettably, none of us take any pleasure or any joy, and we understand the sacrifice this entails, that it can be done for as short a period of time as possible so that the numbers can turn around, things can start to get better. But our job is very simple here. I mean, in the context of having to set priorities, unfortunately, and achieve a balance that's very difficult to achieve, which is to save lives, protect health, protect the health of the employees, protect the health of the customers, and make sure the city can get back on its feet in proper order as soon as possible. And it makes for very tough decisions. None of these are easy. And that's why I was supportive of Premier Ford in doing this and why I recommended it some time ago. But it's not easy.
And just to follow up on that, either for you, Mr. Mayor, or Dr. Davila, we saw today a broad initiative from the province that affects all these establishments across the province. We also saw something really specific and targeted here in the city. Going forward, whether this is a second wave or not, but going forward, what is the approach to take? Is it sort of the broad shut everything down, or just specifically target the things that are at need? Because a lot of places, in speaking to these bars and restaurants this afternoon, they're worried about what comes next, having seen what they've been through.
So my answer to that question is that what we do should be premised on the best available data and evidence that we have. And I think what you're seeing here is evidence of our interest in trying to strike that appropriate balance between COVID-19 control measures and ensuring that we have, access to many of the services and activities that actually add to overall health and quality of life here in the city. So trying to strike that balance may require broad policy changes within certain arenas and more targeted specific actions in other arenas. And it is all about trying to find the right balance premised on the circumstances that we see in front of us, knowing what we know now about how this disease is transmitted. So I think that's how I would summarize our approach overall and what people can expect in the future.
Could I say one more thing? And it relates to a question that was asked of the medical officer of health earlier about evidence that justifies what the province has done, for example, which I fully support, regrettably, but I fully support in terms of hours and also some of the closures that have been undertaken by the medical officer of health today. The reduction in hours is not something that is being done in Ontario alone. It was done some considerable time ago in British Columbia. It is being done in Quebec. It is being done in Europe, in many different countries. And so I'm assuming that everybody has reached the conclusion, without suggesting for a moment that there is any one thing that could be done that's going to stop the spread of COVID-19, that all of those people in all those different places drew some connection between those kinds of hours and the consumption of alcohol and so on, without being against partying or being against these businesses for sure, and that this was in the best interest of public health. And I can assure you, I've listened to Dr. Davila for months. We've sat, the three of us and with a bunch of other people, and made decision after decision that are difficult. And in every case, we've just tried to do what's right, and we've tried to do what's based on the evidence, and we have watched for best practices elsewhere. And unfortunately, some of those decisions cause people to have to make sacrifices, and that is deeply regrettable, but you have to do what you think is right.
Okay, thank you very much for joining us at the last minute and the late hour. To our friends in the media, as Dr. Davila indicated, we will share with you later once those orders have been issued. Please have a safe weekend, everybody. Thank you. Thank you. Thank you, Mr. Mayor. Sure. So.
Not holding my breath on that one, but thank you for the thought.